Hi, my name is Crismel and this is the chapter number 9. Hospitals. Introduction to a hospital. Jordi Pons is a fourth year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Barrow is introducing him to the hospital. Dr. Barrow. The Royal Infirmary is the name of the University Hospital for Edinburgh University. It is a general hospital dealing with all types of patients and illness, except pediatric. We have a specialist hospital for that in another part of Edinburgh, the Hospital for Sick Children. You can see some of the departments in our hospital on the scene. Of course, there are many others, for example, the Intensive Care Unit, ACU, and the Surgical High Dependency Unit, HDU. Jordi, what does outpatients mean? Dr. Barrow. Outpatients are the people who come to hospital to attend a clinic or to have tests of treatment and then return home on the same day. Inpatients stay in the hospital for 1 or more days. The rooms where they stay are called wards. If a patient's treatment requires only 1 day, such as a simple operation, they can be admitted to the day surgery unit. Welcome to the Royal Infirmary. Search and trace. Car parts, C&D, visitor and staff. The Symptom Center for Reproductive Health. Gynecology emergency. Maternity emergency. Neonatology emergency. Outpatient departments or wards, day surgery unit and endoscopy, X-ray department, combined assessment. Outpatients, Dr. Barrow. The accident and emergency department, A&E, also called casualty, is the patients who are actually ill with a sudden serious condition come for assessment and treatment. Outpatients who have an appointment to see a specialist to go to a clinic in one of the outpatient departments, OPDS. They have usually been referred to the hospital by their GP, who writes a general letter to the consultant explaining the patient problem. Inpatients, Dr. Barrow. The inpatients in the hospital are admitted in one of 3 main ways. They may be seen in one of the outpatient clinic and admitted from there, or if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are actually ill. For example, with suspect myocard infarction, or they are seen in the A&E department, where the doctor on duty working at the time arrange admission. This will happen in the case of a patient with fractured neck or femur. For example, large hospitals may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordi, assessed? Dr. Barrow, yes. Decisions are made about their condition and what needs to be done done to help them. After treatment is completed, the patient is discharged back to the GP care. Now I read the chapter 9 in Spanish. Hospitales. Introducción a un hospital. Jordi Pons es un estudiante de cuarto curso de medicina de Barcelona. Ha venido a Gran Bretaña en un archivo adjunto electivo al Royal Infirmary de Edimburgo. El doctor Barron le está presentando al hospital. Doctor Barron, The Royal Infirmary es el nombre del hospital universitario de la Universidad de Edimburgo. Es un hospital general que atiende a todo tipo de pacientes y enfermedades, excepto pediatra. Tenemos un hospital especializado para eso en otra parte de Edimburgo, el Hospital de Niños Enfermos. Puede ver algunos de los departamentos de nuestro hospital en la firmar. Por supuesto, hay muchos otros, por ejemplo, el intensivo, unidad de cuidados intensivos y la unidad de alta dependencia. Jordi, ¿qué significa ambulatorio? Doctor Barro, los pacientes ambulatorios son las personas que vienen al hospital para asistir a una clínica o para hacerse pruebas de tratamiento y luego regresan a casa el mismo día. Los pacientes hospitalizados permanecen en el hospital durante 1 o más días. Las habitaciones donde se hospedarán se llaman salas. Si el tratamiento de un paciente requiere solo un día, como una operación simple, puede ser ingresado en la unidad de cirugía de día. Bienvenidos a la Enfermería Real. Entrada sur, aparcamiento C y D, visitantes y personal, el Centro Simpson para la salud reproductiva, ginecología, maternidad, neonatología, departamentos ambulatorios, todos los barrios, universidad de cirugía, unidad de cirugía de día y endoscopía, servicio de radiología, valoración combinada. Pacientes ambulatorios, doctor Barro. El Departamento de Accidentes y Emergencia, AIE, por sus siglas en inglés, también llamado Casualty, es donde los pacientes que están gravemente enfermos con una afección repentina grave vienen para evaluación y tratamiento. Los pacientes ambulatorios que tienen una cita para ver a un especialista van a una clínica en uno de los departamentos de pacientes externos, OPD. Por lo general han sido referidos a un hospital por su GR, quien recibe una carta de referencia al consultorio explicando el problema del paciente. Pacientes hospitalizados. Doctor Barro, los pacientes internados en un hospital son admitidos de una de 3 formas principales. Ellos pueden ser atendidos en una de las consultas externas y admitidos desde allí. O si hay mucha demanda para el tratamiento que necesita, como en el caso de una prótesis de cadera, se le pone en lista de espera para su ingreso. Alternativamente, su CP puede organizar la admisión por teléfono porque está gravemente enfermo, por ejemplo, con sospechas de un infarto miocardiaco, o se les atiende en urgencias, donde el médico de turno que trabaja en ese momento gestiona el ingreso. Esto ocurrirá en el caso de un paciente con fractura de cuello o de fémur, por ejemplo. Los hospitales más grandes pueden tener una unidad de evaluación donde los pacientes pueden ser admitidos temporalmente mientras se evalúa su condición. Jordi, condición. Doctor Barros, sí, se toman decisiones sobre su condición y lo que se debe hacer para ayudarlos. Una vez que se completa el tratamiento, el paciente dado de alta nuevamente a los cuidados del médico de cabecera. Right. And now I read the exercise, so let me continue. 9.1. Complete the table with words from A, B, and C opposite. Put a street mark in front of the stressed syllable in each word. The first one has done. The first one has been done for you. Verb: admit, assess, discharge, operate, refer, treat. Noun: admission, assessment, discharge, operation, referral, treatment. Main word combination using a word from each box. Look at C opposite to help you. Quality, assessment, on, referral, waiting, unit, letter, list, duty, ill. Actually ill. Assessment unit. On duty. Referral letter. Waiting list. Which hospital? 9.3. Which hospital department would be most appropriate for the following patients? Look at A, B, and C opposite to help you. 1. A woman in coma, diabetic coma, intensive care unit. 2. A patient who has just had a radical prostatectomy, high dependency unit. 3. A patient who is to have a skin lesion removed. Day surgery unit. 4. A man with a forgetting body in his eye. Assessment and emergency. 5. A woman with treatment abortation. Gynecology. 9.4. Complete the exact form and information leaflet for patients. Look at A, B, and C opposite to help you. Information for outpatients. When you arrive at the hospital, please tell the receptionist who will welcome you. Check your delights and direct you to the waiting area. The length of your visit will depend on the treatment you're going to have. You may need to have some tests, such as an X-ray, which you could mean going to another department, or you may be referred to the other professional, such as a physiotherapist or dietitian. You may need to revisit the clinic. If staff at the clinic want to see you again, another appointment will be arranged for you. If you need to be admitted to the hospital for more treatment, either the inpatient for day surgery. You will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP care. My name is Grismel, and this is the chapter number 10. Primary care. The National Health Service. The National Health Service, NHS, is responsible for health care of everyone in the UK. although a small number choose to pay for private care. Treatment is a free, but there is a prescription charge for drugs and appliances, such as a cervical collar, with exceptions for some patients such as children and the elderly. Primary care is provided by general practitioners or GPs, sometimes known as family doctors, nurse, dentists, pharmacists, and opticians. GPs work in practice of 1 to 9 to 20. Practices are based in a surgery and look after the health from 1,000 to 50,000 people in their local community. They also provide health education in areas such as smoking and diet room clinics, give vacations, for example for influenza, and may perform minor surgery, such as removal to warts and moles. If a patient needs specialist care, the GP will make a refer the patient to a consultant in secondary care. Patients are normally seen on appointment basis. Home visits are made when patients are housebound, unable to leave their homes, or too ill to attend surgery. Out of hours OOH treatment for 6 p.m. to 8 a.m. It's provided by the local primary care trust, which organizes chief of GPs and locum GPs to recover if someone is absent. Note: the known surgery has 3 minutes. The building where GP worked, the practice has moved to a new surgery on the high street, a time when GPs see patients. Morning surgery is from 8:30 to 12:30. The work of surgeons. The patient needs urgent surgery on a bruised appendix. The practice team. A typical GP practice employs receptionists. They are responsible for initial patients, contact, making appointments, taking requests for repeat prescriptions, taking messages from patients and other health care providers, and for filling and scanning documents into patients' records. The practice manager has responsibility for finances and sometimes for IT. Supervise reception staff, hires locums, and helps prepare the practice development plan. Practice nurse room, asthma, diabetes, and cardiovascular disease clinic, as well as one-to-one clinic for those who wish to give up smoking. In addition to practice staff, GPs work with a number of health professionals. District nurse visit temporarily housebound patients, such as recently discharged hospital patients, to change dressing, such as ulcer dressing. Health visitor visit families to carry out ups on your children, particularly under fives, to make sure they're healthy. Special attention is paid to families in need, such as those living in property. They also do baby immunizations, wipes, room clinics for maternal patients. Physio- Physiotherapists provide hands-on treatment but also teach patients uh, exercise they can do to improve their condition after an accident or operation. A GP's day. Doctors who are working in a practice in a small market town with three other family doctors. The surgery is in the camp center of the town and is charged by three patients. This is a typical working morning when she is not the duty doctor, responsible for emergencies and urgent problems. Read the chapter 10 in Spanish. Atención primaria. El Servicio Nacional de Salud. El Servicio Nacional de Salud, NHS, es responsable de la atención médica para todos en Reino Unido, aunque un pequeño número opta por pagar la atención privada. El tratamiento es gratuito, pero hay un cargo por prescripción de medicamentos y apartados como un collarín cervical, con extensiones para algunos pacientes con niños y ancianos. La atención primaria es proporcionada por médicos generales o médicos de cabecera, a veces conocidos como médicos de familia, enfermeras, dentistas, farmacéuticos y médicos de cabecera. Trabajan en prácticas de 1 a 20. Las prácticas se basan en una cirugía y cuidan la salud de 1,000 a 15,000 personas en su comunidad local. También brindan educación sobre la salud en aspectos como lavaquismo y dieta. Administran clínicas, administran vacunas, por ejemplo, contra la influenza, y pueden realizar cirugías menores como la eliminación de verrugas y lunares. Si un paciente necesita atención especializada, el médico de cabecera debe hacer una derivación, derivar al paciente a un consultor en atención secundaria. Los padres normalmente se ven con una cita previa. Las visitas domiciliarias se realizan cuando los pacientes están confinados en sus casas, no pueden salir de sus hogares o están demasiado enfermos para asistir a la cirugía fuera del horario OOH de 6 p.m. a 8 a.m. Es proporcionado por el Fideicomiso de Atención Primaria Local, que organiza turnos de médicos generales y médicos suplentes para cubrir si alguien está ausente. Nota: el sustantivo cirugía tiene 3 significados. El edificio donde funciona el GPS o GPS. La práctica se ha trasladado a una nueva cirugía en High Street. Un momento en el que GPs ve a los pacientes. La cirugía de mañana es de 8 a.m. de 8:30 a.m. a 12:30 p.m. El trabajo de los cirujanos. El paciente necesita cirugía urgente en el apéndice reventado. El equipo de práctica. Una práctica típica de médico de cabecera emplea a recepcionistas, los responsables del contacto inicial con el paciente, programar citas, recibir solicitudes de recetas repetidas, recibir mensajes de pacientes y otros proveedores de atención médica, y archivar y escanear documentos y registros de pacientes. El gerente de la práctica tiene la responsabilidad de las finanzas y a veces de ti supervisar al personal de recepción, contrata suplentes y ayuda a reparar el plan de desarrollo de la práctica Practicantes dirigen clínicas de asma, diabetes y enfermedades cardiovasculares, así como clínicas individuales para aquellos que desean dejar de fumar. Además del personal de práctica, los médicos de cabecera trabajan con varios profesionales de la salud. Consulta la unidad 8. Eh, Sus enfermedades varían a los pacientes temporalmente eh, cuando, además del personal de práctica, los médicos de cabecera trabajan con varios profesionales de la salud. Distrito. Las enfermeras visitan a los pacientes temporalmente confinados en sus casas por los que han sido dados de alta recientemente en un hospital. Pacientes para cambiar apósitos como apósitos para úlceras. Los visitadores sanitarios visitan a las familias para realizar chequeos a los niños pequeños, en particular como los que viven en la pobreza. También vacunan a los bebés. Las parteras administran clínicas para pacientes prenatales. Los fisioterapeutas brindan tratamiento práctico, como también enseñan a los pacientes ejercicios que pueden hacer para mejorar su estado después de un accidente u operación. Día del médico de cabecera. El doctor Stuart trabaja en un consultorio de un pequeño pueblo comercial con otros 3 médicos de familia. La consulta se encuentra en el centro del pueblo y es compartida por 3 consultorios. Esta es la típica mañana de trabajo en la que ella no es el médico de guardia responsable de emergencias y problemas de urgencias. 8 a.m. llegará a la cirugía, verifique la copia impresa de correo electrónico de COH, consultar por alquiler y mensajes no urgentes. 8:30, consultar correos de Junta de Salud y socios, prepararse para la cirugía. 8:30 a 10:50 de la mañana, cirugía, citas de 10 minutos, reservado la semana pasada, reservado hora por delante, 4 reservadas al día. 10:50, 10:55, consultar la recepción para mensajes, firmar recetas y tratar con recetas repetidas. 11 a 11:20, un descanso para tomar café en la sala de conferencias con colegas. 11:20 a 11:30, consultar solicitudes de visitas domiciliarias y repetir visitas con C. 11:30 a 1, visitas domiciliarias. Read the exercise. 10.1. Complete the sentence. Look at A opposite to help you. Children over 90 cents and people with some chronic disease do not have to pay prescription shares in the UK. 2. Patients with mobility problems may be unable to go out. There are house births. 3. The average GP appointment is 10 minutes long. A locum is someone who takes the place of a staff member who is on leave. 5. Carousel working hours in non-has out of hours treatment. 10.2. Make word combination using a word or phrase from each box. One word can be used twice. Look at A and B opposite to help you. Change, make, before, perform, refer, room, supervise, take, massage, staff, appointments, home visits, dressings, a clinic, a patient's minor surgery. Change 1. Change dressing. 2. Make appointments. 3. Make home visits. 4. Perform minor surgery. 5. Refer a patient. 6. Room a clinic. 7. Supervise staff. 8. Take message. Which member of a practice team will be responsible for each of the following? Look at B opposite to help you. 1. Running a clinic for pregnant women, midwife. 2. Technique a patient who to treatment is broken leg, physiotherapy. 3. Letting a GP know that a patient can come to her appointment, receptionist. 4. Running a clinic for people who want to lose weight, practice nurse. 5. Visiting a patient who has just returned home after a hernia operation, district nurse. Carrying out check-ups on children in a poor neighbor, neighborhood, neighborhood. A health visitor. Organizing cover for an absent doctor, practice manager. Complete the diary for Dr. Stewart afternoon. Look at A and C opposite to help you. 1 p.m. to 1 p.m. to 2 p.m. Practice team meeting over sandwich lunch. 2 p.m. to 4 p.m. Afternoon surgery. 12 10 minutes appointments. 4 for 4:20 p.m. Coffee break. 4:20 to 5 p.m. Check with receptionist for massage. Deal with home visits and repeat prescriptions requires. 5 p.m. to 6 p.m. Paperwork. A.G refers to secondary care, admitted tax, telephone calls to patients, private medical examinations. 6 p.m. Phone switches to OOH service. My name is Crismer and this is the chapter number 11. Medical Education, Part 1. Medical Education in UK. Medical education in the UK covers undergraduate education, 4 or 5 years at medical school, the section of a university responsible for medical education, a 2 years foundation program, which provides training for a new doctors after graduation throughout a series of placements in different specialties. Postgraduate training, which doctors take and become GPs or consultants. Senior specialists, often delivered through college for different specialties, for example, the Royal College of Physicians. Continue professional development in the front of course and seminars, which doctors undertake without their working lives to keep up the date. Extract for an undergrad prospectus. The MBCHB Bachelor of Medicine, Bachelor of Surgery is a 5-year undergraduate medical degree course. Most of your learning takes place in a small group. The main components are core years 1, 2, 3. An integral program of clinical and specific topics mainly presented through problem-based learning PBL, where you work with others on a series of case problems. Student Select Modules. Student Select Modules, SSMS, allow you to choose from a menu of subjects such as sports medicine or even student a language as preparation for an overseas elective, a hospital achievement of your one choice between years 4 and 5, vocational students and clinical skills. The components prepare you for the clinical skills required for contact with patients from year 1 of your course throughout periods to practical training where you are attached to a hospital department or general practice. Clinical achievements, years 4 and 5, a series of 4-week clinical achievements in medicine, surgery, psychological medicine, child health, obstetrics and gynecology, and general practice. A student's view. Ellen, a medical student, describes her course. I'm just finished my first year of medicine. What I like about this course is what you are involved with patients from the very beginning. Even in our first year, we spend time in hospital. Much of the course is BPL, PLB, PLB, where we have 2 hour sessions a week where we work in groups for 8 to 10, solving clinical problems. We decide together who to tackle the problem, look up books and online source, make notes, and discuss the case together. It's a great way for learning and getting to know the other students. In the past, medical students had lectures with the whole class taking notes for lectures from 9 to 5, but now it's mainly group work. Throughout, we do have some lectures and seminars where we work in small groups with a tutor. I like to all of it, even the dissections. We get to cut up cadavers from the second month of the course. Now I read the chapter 11 in Spanish. Educación médica parte 1. Educación médica en el Reino Unido. La educación médica en el Reino Unido cubre educación universitaria, 4 o 5 años en la Escuela de Medicina, la sección de una universidad responsable de educación médica. Un programa básico de 2 años que brinda capacitación para nuevos médicos después de la graduación a través de una serie de prácticas diferentes especiales. Formación de posgrado que los médicos toman para convertirse en médicos de cabecera o consultores, especialistas superiores a menudo impartidos a través de colegios para diferentes especialidades, por ejemplo el Royal College of Physicians. Desarrollo personal continuo en forma de cursos y seminarios que los médicos emprenden a lo largo de su vida laboral para mantenerse al día. Extracto de un proceso de posgrado. MBHB, licenciatura en medicina, licenciatura en cirugía, es un curso de posgrado en medicina de 5 años. La mayor parte de su aprendizaje se lleva a cabo en grupos pequeños. Los componentes principales son básico, de 1 a 3 años, un programa integrado de temas clínicos y científicos presentados principalmente a través del aprendizaje basado en problemas. PBL, donde trabaja con otros en una serie de problemas de casos. Módulos seleccionados por los estudiantes. Los módulos seleccionados por los estudiantes SSM permiten de un menú de materias como medicina deportiva o incluso estudiar un idioma como preparación para una electiva en el extranjero, un archivo adjunto de hospital de su propia elección, ginecología, medicina general, entre los años 4 y 5. Estudios vocacionales y habilidades clínicas. Este componente lo prepara para las habilidades clínicas requeridas para el contacto con pacientes desde el año 1 en su curso a través de periodos de capacitación práctica en los que está adscrito a un departamento hospitalario o práctica general. Usted elige adjuntos clínicos años 4 y 5. Usted elige adjuntos clínicos, años 4 y 5, una serie de adjuntos clínicos de 4 semanas en medicina, cirugía, medicina psicológica, salud infantil, obstetricia. La visita de un estudiante. Ellen, una estudiante de medicina, describe su curso. Estoy terminando mi primer año de medicina. Lo que me gusta de este curso es que te involucras con los pacientes desde el principio. Incluso en nuestro primer año pasábamos tiempo en el hospital. Gran parte del curso es ABP. Tenemos 2 sesiones de 2 horas a la semana en las que trabajamos en grupos de 8 a 10 para resolver problemas clínicos. Decidimos juntos cómo abordar el problema, buscamos libros y fuentes en línea, tomamos notas y discutimos el caso juntos. Es una gran manera de aprender y conocer a otros estudiantes. En el pasado, los estudiantes de medicina tenían conferencias con toda la clase tomando notas de los profesores de 9 a 5, pero ahora es principalmente trabajo en grupo, aunque tenemos algunas conferencias y seminarios donde trabajamos en pequeños grupos con un tutor. Me gusta todo, incluso la disección. Llegamos a descuartizar cadáveres o a descuartizar, no. Llegamos a cadáveres a partir del segundo mes del curso. Now I read the exercise. 11.1. Match these activities to the stage of medical education in the UK given A opposite. 1. Dissecting cadavers. Undergraduate. 2. Keeping a log of surgical procedures observed and performed. Postgraduate. 3. Working for 4 months in accident and emergency to experience this specialty. Foundation program. 4. Taking a 4-week achievement in obstetric and gynecology. Undergraduate. 5. Taking an online course on recent developments in cardiovascular disease, continuing professional development. 11.2. Complete the sentence. Look at B and C opposite to help you. 1. Just before the final year, a student has the chance to take a elective in a hospital for their choice anywhere in the world. 2. Problem-based learning contacts with the approach where each subject is taught separately. 3. These days, electives are often interactive with regular opportunities for the student to ask questions. 4. In clinical achievement, students learn how to treat and manage patients. 5. Students select modules can be a topic from outside medicine such as a foreign language. 6. Dissection of cadavers is an important part of the anatomy component. 7. The medical school at the University of Edinburgh, is one of the oldest in the UK. Age. She is a consultant at the Royal, one of the leading pediatric hair specialists in the country. 9. The Royal College of Surgeons in Edinburgh from 1505. 10. When we have a senior each week there we discuss topic in a small group with our lecturer. 11.3. Match each of these activities to one of the components of the undergraduate course described in a B and C opposite to the opposite. 1. Julie spent 6 weeks working in a small hospital in the Himalayas. Overseas elective. 2. A group of students discuss together the possible reason for abdominal pain after meals in a BPL. Obese 4 years 44 years old male. Problem-based warning. 3. A small group of students trace the pulmonary artery in a cadaver dissection. 4. Otto spent a month working in the pediatric ward of the local hospital. Clinical achievement. 5. Annie learns how to take blood from an elderly patient. Clinical skills. 6. Juma chooses to study travel medicine in this fourth year. Student selective model. Hi, my name is Chris Mel, and this is the chapter number 12. Medical Education Part 2. The Foundation Program. The Foundation Program is a 2-year training program which forms to bridge between university level study at medical school and specialists of general practice training. It consists of a series of placements, each lasting 4 months, which allow the junior doctor, known as a trainee, to sample different specialties, for example, pediatrics. A year of one trainee, FY1, corresponds to pre-registration house office, PRHO, post a year to trainee, FY2, to senior house officer, SHO, post. Each trainee as an educational supervisor who ensures that more senior doctors deliver training in a different way, including clinical and education supervision. To progress, trainees have to demonstrate a range of clinical competencies which are assessed through observation in their workplace. People in the medical education. Tutor, an academic or in some cases a postgraduate student who leads tutorials. Demonstrator, in anatomy teaching, some who demonstrates who to dissect. Demonstrators are often postgraduate students paying their way through medical school. Lecturer, senior lecturer, an academic with teaching and prestige responsibilities who contribute to the teaching of the particular discipline. Professor, a senior academic with teaching and research responsibilities for a particular discipline, usually a learning figure in their discipline. College tutor, a consultant responsible for delivering a college training program. Clinical trainer, A consultant assigned to training who provides training during periods of direct clinical care. Educational supervisor. A consultant who supervises a trainee's periods of training. Medical qualification. BMSc. Bachelor of Medical Science, a degree for often taken after 3 years of medical studies by students who may wish to follow a career in medical research. MBHP, MBBS, BMBCH, BMBS. Bachelor of Medicine, Bachelor of Surgery. Bachelor degrees are undergraduate degrees. This is the first degree for UK doctors. MD, DM, Doctor of Medicine. DRCOG, the Diploma of the Royal College of Obstetrics and Gynecology. MRCP, member MRCP, MRCS, member of the Royal College of Physicians or member of the Royal College of Surgeons. Doctors become members by successfully completing the assessment procedures in their college. FRCS, FRCS-ED, FRCS Glass, FRCSI, Fellow of the Royal College of Surgeons of England. Other colleges are indicated by the letters which follow. For example, Edinburgh, Glasgow, or Ireland. Who doctors become a fellow depends on their college. For the FRCS, further examination must be passed. For the other college, it is by nomination for work assessment. Now I read the chapter 12 in Spanish. Educación Médica Parte 2, un programa de la Fundación. El programa de la Fundación es un programa de formación de 2 años que sirve de puente entre un estudio de nivel universitario en la Facultad de Medicina y formación especializada o en práctica general. Consiste en una serie de estancias de 4 meses de duración cada una, que permite a un médico adjunto, conocido como aprendiz, para aprobar diferentes especialidades, por ejemplo, pediatría. Un año 1, FI1 corresponde a puestos de oficial de casa de preriesgo, PRHO, o un aprendiz de año 2, FI2, a puestos de oficial superior de casa, SOH. Cada alumno tiene un supervisor educativo que se asegura de que los médicos más experimentados brinden capacitación de diferentes maneras, incluida la supervisión clínica y educativa. Para progresar, los alumnos deben demostrar una variedad de competencias clínicas que se evalúan a través de la conversación, de la observación en otro lugar de trabajo. Personas en educación médica. Tutor, un académico o en algunos casos un estudiante de posgrado que dirige tutoriales. Demostrador, en la enseñanza de la anatomía, alguien que se muestra cómo diseccionar los demostradores suelen ser estudiantes de posgrados que pagan sus estudios en la Facultad de Medicina. Profesor o titular, un académico con responsabilidades docentes y de investigación que contribuye a la enseñanza de una disciplina particular. Profesor, un académico senior con responsabilidades que enseña a investigación para una disciplina en particular. Suelen ser una figura destacada en su disciplina. Un profesor universitario, un consultor responsable de impartir un pack de información universitaria. Programa. Entrenador clínico, un consultor asignado a un aprendiz que brinda capacitación durante periodos de atención clínica directa. Supervisor educativo, un consultor que supervisa el periodo de formación de un aprendiz. Cualificaciones médicas. BMSC, licenciado de Ciencias Médicas, un título que a menudo obtienen después de 3 años de estudios médicos los estudiantes que deseen seguir en una carrera de medicina de investigación. MBCHB, MBBS, BMBCH, BMBS, licenciado en medicina, licenciado en cirugía. Los títulos de licenciatura son títulos de posgrado. Este es el primer título para médicos del Reino Unido. MD-DM, doctores de medicina. DRCOG, diploma de Royal College of Obstetrics and Gynecology. MRCP, MRCS, miembro del Real Colegio de Médicos o miembros del Real Colegio de Cirujanos. Los médicos se convierten en médicos al completar con éxito los procedimientos de evaluación en su colegio. FRCS, FRCS-ED, FRCS Glass, FRCSI. Miembros del Royal College of Surgeons of England. En otras universidades se indican con las letras que siguen, por ejemplo en Edimburgo, Glasgow o Irlanda. Las formas en las que los médicos se convierten en becarios depende de la universidad. Para el FRCS se deben aprobar exámenes adicionales. Para otras universidades es por nominación o evaluación del trabajo. Now I read the exercise. 12.1. Complete the phrases with verb from the box. 2 phrases can be completed in 2 different ways. Look at A, B, and B opposite to help you. Assess, deliver, demonstrate, provide, supervise, take. Demonstrate a competence or who to do something. 2. Supervise a trainee by ensuring they successfully completes her training. Provide a course. 3. Provide a course of training program as a teacher. 4. Take a course or training program as a student. 5. Assess programs or competencies. 12.2. Match the 2 parts of the sentence. Look at A, B, C opposite to help you. 1. An FY1 is a doctor with D in the first year of the foundation program. 2. A demonstrator is an anatomical teacher with H who teaches dissection. 3. A clinical training is a consultant with F who provides training during periods of direct clinical care. 4. A supervisor is a consultant with B, responsible for the training program of a trainee. 5. A medical school is, with G, a part of the university responsible for medical education. 6. A placement is C, with C, a period spent as a trainee in a hospital of the general practice. 7. A college is, with A, body of specialists responsible for delivering and assessment training in their specialties. And 8. A fellow is a specialist, with E, who has reached the highest level in their specialties. 12.3. Write in full the qualification of the doctors and surgeons. Look at C opposite to help you. 1. M.R.A.H. Johnson, M.B.C.H.B. F.R.C.S. F.R.C.S.I. Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons of England. 2. Dr. C. Dowley, B.M.E.D., LCE, D.M.R.C.P. Bachelor of Medical Science, Doctor of Medicine, member of the Royal College of Physicians. 3. Miss E. English, MBBS, FRCS, Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons. 4. Dr. E. Merriwater, BMMD, FRCP, Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College of Physicians. Hi, my name is Grismel and this is the chapter number 13. The Overseas Doctor. Type of registration. To manage and treat patients in the UK, all doctors must register with the General Medical Council, GMC. There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area (EEA) member states. Full registration is for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of training (CCT). The GP register is a register for all those eligible to work in general practice in the NHS. Note: for the deletes of the General Medical Council, see www.gmcuk.org. Plabi. Before the optation for registration, some categories of several doctors are required to take the Professional and Linguistic Assessment Board (PLAB) test. PLAB is designed to ensure those who pass can practice safely at the level of a SHO in a first appointment in the UK hospital. Part 1 consists of a written test of knowledge, skill, and aptitudes. Part 2 is an objective structured clinical examination, OSCE. It consists of 16 5-minute clinical scenarios known and stationed to assess professional skill. PLAB stations and advice. OCSES assess the skills. Clinical examination, your ability to carry out physical examination of a simulated patient, and a doctor training to play this role will be assessed. Uncomfortable or intimate examination will be carried out using machining and anatomical model. Practical skill. You will be assessed on practical skills such as suturing and giving intravenous injections, communication skill, your ability to interact with a simulated patient, or in some cases, the examiner will be assessed. Skill tests may include breaking bad news and giving advice of lifestyle, story taking, your ability to take a accurate history and make a reasoned diagnosis will be assessed. Advice of the station from a successful candidate. Read the instructions inside each station carefully. You have 1 minute for this. Don't forget the ABC airways, breathing, circulation protocol in every emergency station. Keep in mind safety precautions like storing the sharps in the sharps beam. Check the patient, understand what is happening. Then ask them about any concerns they maybe have. Don't just give a lecture. Listen carefully to what the actor says. Note: sharps are nailers and blades which must be disposed of safely in a special container called a sharps bin. Now I read the chapter 13 in Spanish. El médico extranjero. Tipos de registros para administrar. Tipos de registro. Para administrar y tratar pacientes en el Reino Unido, todos los médicos deben registrarse con el Consejo Médico General. GMC. Hay varios tipos de matrícula. La matrícula provisional es para médicos que acaban de graduarse de la Facultad de Medicina en el Reino Unido o en ciertos estados miembros del Espacio Económico Europeo. III. EEE. La inscripción completa es para médicos que han completado su año de capacitación clínica. La inscripción limitada es para los graduados médicos internacionales que no han completado el equivalente a un año de formación clínica en el Reino Unido. El registro especial es para médicos que han completado la formación médica especializada y tienen un certificado de finalización de la formación CCT. El registro GP es un registro de todos los elegibles para trabajar en la práctica general de NHS. Nota: para poder obtener detalles, consejo médico, consulte www.gmcuk.org. PLAB. Antes de que puedan obtener el registro completo, se requieren algunas categorías de médicos extranjeros. Para tomar la prueba de la Junta de Evaluaciones Lingüísticas y Profesionales, PLAB está diseñado para garantizar que los que aprueben puedan practicar de manera segura a nivel de un SHO o en una primera cita en un hospital del Reino Unido. La parte 1 consiste en una prueba escrita de conocimientos, habilidades y actitudes. La parte 2 es un examen clínico estructurado objetivo, OSCE. Consta de 16 escenarios clínicos de 5 minutos, conocidos como estaciones para evaluar las competencias profesionales. Estaciones y consejos. La OSCE evalúa estas habilidades. Exploración clínica. Se evalúa su capacidad para realizar una exploración física de un paciente simulado, un actor entrenado para desempeñar este papel. Incómodo o íntimo, los exámenes se realizarán utilizando un maniquí o un modelo atómico. Habilidades prácticas, que se evaluarán en las habilidades prácticas como suturar y aplicar inyecciones intravenosas. Habilidades de comunicación. Se evaluará su capacidad para interactuar con un paciente simulado o en algunos casos con el examinador. Las habilidades evaluadas pueden incluir dar malas noticias y dar consejos sobre estilos de vida. Elaboración de la historia clínica. Su capacidad para elaborar una historia precisa y hacer un diagnóstico relacionado se evaluará. Consejo sobre las estaciones de un candidato exitoso. Lea atentamente las instrucciones fuera de cada estación. Tienes un minuto para esto. No olvides el protocolo ABC, vías aéreas, respiración y circulación, y cada estación de emergencia. Tenga en cuenta las precauciones de seguridad como tirar los objetos punzantes en el contenedor de objetos punzantes. Verifique que el paciente comprenda lo que está sucediendo. Luego, pregúnteles acerca de cualquier inquietud que puedan tener. No se limite a dar una conferencia. Escuche atentamente lo que dice el actor. Nota: los objetos punzocortantes son agujas y cuchillos que deben desecharse de forma segura en un contenedor especial llamado contenedor de objetos punzantes. Now I read the exercise. 13.1. What kind of registration might these doctors obtain? Look at A opposite to help you. 1. A newly qualified Spanish doctor. Provisional registration. A newly qualified Nigerian doctor. Limited registration. A doctor who has successfully completed the first foundation year, FY1. Full registration. An ASHO who has successfully completed the foundation program and gained a certificate of completing the training after several specialist registration posts. Specialist registration. 13.2. Write the abbreviators in Word. Look A, B, C opposite to help you. 1. Any doctor who wants to work in the UK must register with the GMC, General Medical Council. 2. Some overseas doctors must pass the PLAB test before they can register. Professional and Linguistic Assessment Board. 3. Part 2 of the test consists of an OSCE, Objective Subtracted Clinical Examination. 4. In any emergency, remember the ABC protocol: airways, breathing, and circulation. 5. Before you can obtain a specialist registration, you must have a CCT, Certificate of Completion of Training. 13.3. Complete the text. Look at ABC opposite to help you. My name is Musa, and I come from Yemen. I came to the UK about 2 years ago after graduating. Because Yemen is outside of EEA, I could only obtain limited registration with the GMC at first. It was very difficult for me to obtain a place of foundation program. Although I speak good English, I had to take the PLAB test to show that I could work safely in the UK. If had to give some advice to other candidates, it would be that at counseling station, you should simply memorize a set of phrases. It's better to really think about what you're saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get an SHO post in my chosen specialty. Pediatrics as hospitals who have to demonstrate there isn't suitable candidate from the EEA. Once I've completed my second foundation year, I should obtain a CCT, which will allow me to progress to specialist registration with the GMC, an important step on the road becoming pediatric consul.